what you've got in eating disorders is a complex, deadly, and quite vicious illness. It's the highest mortality of any mental health illness, and it affects something like 6% of women in the UK have an eating disorder, and 16% are at risk of one. And whilst the percentages are lower for males, we think that's because it's underreported. So you've got a highly prevalent, deadly, destructive illness that the NHS was struggling to deal with before COVID. And in the last 2 years, COVID has driven incidence up several fold. So referrals into my charity are up 500% from what they were 2 years ago. To tackle such an illness, you can't just prescribe a pill, when people are ill. We can't operate. It's not an easy to fix illness because it has genetic basis, it has physiological elements, and it has a mental health element. So it's a very complex, difficult to treat. But what has been proven to work is early intervention. The earlier you intervene, the earlier you provide support and effective intervention to people, the less likely it is to kill them or to destroy their lives and the lives of others. So at Maudsley Hospital developed this model called FREED, which is an early intervention model to target people between 16 and 25 that is shown to stop them from the long-term consequences. It helps them recover, and it means that statistically they go on and lead a quality of life that is sort of relatively normal. We've now got to a situation where we have what we call freed champions, i.e. people who are trained to provide that early intervention service, hired, recruited, in place across the east of England, and we're treating people. People with this illness are coming. They're being, responded to by the free champions, and they're getting help. That a year ago wasn't available. That's what the Academic Health Science Network has done. It's taken this proven model out of Maudsley. It's rolled it out across the east of England. It's hired people up, and we are treating people. The Academic Health Service Network support of the rollout of FREED in the east of England is a massive source of hope. FREED is in essence a way of intervening early to help people that are suffering an eating disorder that prevents them from getting entrenched in the illness. So the earlier you act to provide help to people, the better their chances are of recovering quickly and going on to live their lives to the full potential. So if I go back to the early days when I first got involved, what I saw was a team from the network get hold of this, come up with a plan for how you'd roll out this service, engage a number of stakeholders in the development and rollout of that plan, and then put it into action. Start actually hiring people, training people, providing them with the knowledge and the material that they needed to be effective free champions, put them in place, support them to get on board and start delivering this service. I mean, that couldn't have happened without some very skilled committed, knowledgeable about the NHS and the system and about the illness folks, and that's what the network provided. It's so dreadful is the other truth of it. This I don't think people that haven't been touched by the illness really understand just how dreadful it is. You know, not just how deadly it is because it kills people, that's bad enough, but the way it kills people is truly awful. You know, there's not another illness really like it that can take hold of somebody and destroy their life and destroy the lives around them in such a vicious, painful, agonizing way. It's horrendous. Intervening early on it's vital. You know, it's absolutely vital. Ultimately, it's about helping people find a life to get well for, find a life that actually means more to them than the illness does, because that's how bad this illness is. You know, Emma was dying in hospital, but she still feared recovery. So she self-discharged herself and died 36 hours after discharge because she couldn't bear the consequence of getting well. That's how bad it is, you know. And so when I kind of reflect on it, there's a few kind of hopeful things that are happening. One of them is this. One of this is the fact that we now have an early intervention service in the east of England that we didn't have before. That's a good thing. That's going to have immeasurable help to people who are suffering.